They're called test hoppers, people who repeatedly test positive for COVID-19 in a short period of time, and they could be inflating the numbers of positive cases in Georgia. Archie Seshadri reports from our Atlanta bureau.
Augusta University can test up to 1,000 people a day, but they don't know if their test is the only test the patient is getting.
If someone got a test at CVS yesterday and then comes to us tomorrow, we have no visibility of that and really no way of preventing it.
Test hoppers, those who may test at several locations, may skew the health data.
We've had one that I'm aware of that even tries to get tested daily because she cares for a medically fragile person. Obviously, that's not appropriate.
State numbers from Monday show a discrepancy of nearly 500 confirmed cases or people and positive tests. AU has a system to prevent multiple tests by one person.
If somebody has a positive, we actually put up a pop-up alert in our system, in our EMR, that won't allow someone to order the test again within 14 days because there's no indication to repeat test someone that has been positive.
The state says if someone tested positive 10 days ago and retested today, they would not be added as a confirmed case, but would be added in the positive tests.
More testing will not increase the number of cases. The cases are already there. No one is immune to it until you develop antibodies.
Tuesday's data also shows that if a provider confirms a case directly without a lab report, it would show a higher confirmed case number than positive tests.
And if someone tests negative, we lock that out at 72 hours because generally there is no indication to repeat test someone within 72 hours.
Reporting in Atlanta, Archit Seshadri, WJBF News Channel 6.